Hello, I'm Rose, hypnotherapist, mother, teacher, human being. If you're asking the question, do I need therapy? It seems like therapy will be valuable for you. Therapy is best if the person is very much engaged in the process because the outcomes really come from you. Your therapist will guide, but the outcomes come from you. In the world we live in and the structure of society, the vast majority of us will have grown up with conditions of worth where we are good because of this. We are loved because of this. We are congratulated and celebrated because of this. As soon as you have those things, which are generally speaking very well meaning, then what you actually are starts to fall down a different path and patterns start to emerge. In therapy, we look at these patterns and we see how they're impacting you now. And anything which is weighing you down or making you feel stuck, we can usually trace down to one of these patterns, which we can then work around, try to undo any knots, and help you to bring a new pattern that serves the person that you are now. Hypnotherapy isn't what people generally think it is. We use hypnotherapy in order to quiet the active part of the mind so that the unconscious mind can allow itself to show a bit more. Some people fear this, having seen films where people get out of control. It really isn't like that at all. In hypnotherapy, you are always completely in control. When you are under hypnosis, you are completely in control. So you only relax to the point that you feel safe to relax to. So as the relationship develops between you and your therapist, you find that you feel more comfortable to go deeper and deeper and deeper. And when you go deep, you're the one who's bringing out the things that you want to bring. The therapist never forces the things out of you. So it's really not something to fear. What you get is a sort of trance-like state. And a trance-like state is quite a pleasant feeling, nice sort of relaxed feeling where your mind's not worrying too much. And you might liken it to when you're driving, for example, and you're driving on a really familiar route, and then you suddenly blank out and you're like, where am I? Where am I? What year is it? That's a sort of trance-like state where you've just zoned out completely. I'm a secondary school teacher myself and have been for 20 years, and I'm very familiar with the pressures that are upon teachers. So we work at a very, very fast pace. We work at a very, very high level. We work at a level where we have very high expectations on ourselves and high expectations on others. And as part of that, a lot of the conditions of worth that we were fed as children re-emerge within our practice as teachers. The way that therapy often helps teachers is really by reframing and standing in a different spot, standing in a different place, so that you can feel very comfortable and calm in who you are, what you've achieved, what you're doing, where you're going, what you can provide, without that feeling that you're never quite good enough, without that feeling like there's always something chasing you. Removing that feeling, and you'll actually find in that process that you might re-engage with a real love of teaching again, a real love of being in the classroom, a comfort with the environment as busy as it is. And I do find that with teachers when I speak to them. Therapy is one of those rare environments where you can really come as you are. You don't need to bring anything except for you as you are there and then. You don't have to prepare anything. You don't have to remember what happened last session. You can just bring exactly what you're feeling at that particular moment as the therapist asks you. So there is no pressure whatsoever on you. For the 50 minutes, which is the session length, you will talk about something. Sometimes you will talk a little bit, and then there will be some moments where the therapist will guide you to dive and will try to explore something. Sometimes you will have moments where there are pauses where you are working something out. Sometimes you will feel like you are thinking a lot because you're trying to understand something. A lot of the good therapy takes place when you're quite emotionally activated. So tears are common. Doesn't mean you're upset. It's just a realization. Sometimes you can feel very much at peace after it. Sometimes you may feel like something hasn't finished yet. And that means that the next session, we will open that back up and you will be doing work in between as well to try and make sure that you're working on that particular knot at that particular time. So within the session, you come exactly as you are. And the relationship between us is what will enable you to feel that you can move to the places that you really need to go to. It doesn't happen within the first session. Within the second session, maybe a bit more, third session, a bit more, fourth session is where you're most likely to start feeling a level of comfort where you feel like you can start really diving in. And as the relationship develops, the deeper you are able to go. In therapy, rather than seeking an outcome, we orient towards a goal if you have one. Some people don't have a goal. Maybe they have a goal of, I just want to feel better. I don't want to feel like this anymore. And that can be a goal in itself. And what we do is we position ourselves so we're trying to move towards that goal. And we do it together, and we do it very much collaboratively. But we never guarantee outcomes. And that is very much a part of the process of therapy. The whole world tells you that this is what you're going to achieve and this is what you're going to do to get it. We don't operate like that in therapy. And it's the breaking down of those expectations and those conditions that is actually part of the healing process. So we'd never promise outcomes or guarantees, but you will find value in the orientation and in the journey that you take to reach whatever goal that you set for yourself, should you set yourself a goal. Different clients will need a different number of sessions. If you have a very specific need and you know where exactly you want to go, you may just have 6 or 7 sessions, maybe up to 10 sessions. If you have more complex needs or you don't really know what the issue is, you just know there's an issue, there's a lot more exploration and areas that it might go to. So you just don't know how long it's going to take. Some people stay in therapy for years. Some people stay in therapy forever. Some people stay in therapy just for maybe 6 months. And that can be enough to really change the patterns. And if you stay in therapy for 6 months and change even some very deep patterns, you may then come back once a month or every 3 months or something like that, just to make sure that you are still exactly where you want to be. Therapy takes many different forms. The form that I do is called integrative therapy, and I have a person-centered approach, which means that I trust your own resources. Because I'm integrative and not just person-centered, I also use parts work, where we will explore different parts of yourself that may have arisen to protect you or to help you out in the past. And perhaps some of them you're aware of and some of them you might not be. I also use somatic work, so understanding the link between the mind and the body. They're ones that you'll see me using regularly. And I use hypnotherapy to try to get the unconscious mind to generate the treasures that it has inside so that we can work out what we're looking for. And in that process, you will be listened to, of course. What I'll be doing is trying to work out what those patterns are underneath and the appropriate points to dive in, always with your permission. With counselling, they may do something quite similar. So you can get a counsellor who operates very much like a therapist. You can get a therapist who operates more like a counsellor. In theory, counselling is less deep and therapy is deeper. I may or may not be the right therapist for you. That will be very much based on your feeling, and you get a bit of a feeling as you watch these videos. You sort of think, yeah, that person could understand me, or I really couldn't attune to that person. That's what you need to be thinking. Can I tune to that person? Have a look at the website, see if it resonates with you. And if you're still looking for a therapist, but you don't really think I'm the right one for you, by all means get in contact, and I have other people that I can signpost you to as well. Many therapists will have a 10 or 15-minute initial free chat so that you can speak to them. I do as well. If you would like to speak to me, please have a look in the bio and you'll see my contact details so that you can contact me. Should you wish to have an initial chat before booking a therapy session, when we have that, we can discuss if there's any reasons why we wouldn't work well together, and there can be reasons sometimes. And if that is the case, then I can always signpost you to somebody else. If this video has resonated with you and you'd like to get into contact, please do so via the links below. The website is www.shifarosetherapy.co.uk, and you can get in contact with me via email or WhatsApp message. Apologies if I don't answer. If you call, I may be in a therapy session, I may be teaching. So please do message rather than call. And we can book in a free initial call just to check suitability, to check that it's something you want to go ahead with, and then we can book in the sessions. Sessions are charged at £75 per session, and I ask for the payment in advance by 2 days. You can book ad hoc, so you can book week by week. I look forward to hearing from you.